It's time for this week's edition of the Bronson Health Chat on WKZO. Bronson is once again scheduling less urgent and elective surgeries now that COVID-19 appears to have stabilized in the communities Bronson serves. Bronson has instituted a number of additional safety protocols for patient safety, and we're going to talk about that right now with Dr. Andrew Gordon, a board-certified surgeon at Bronson Methodist Hospital in Kalamazoo and a member of the American College of Surgeons. Dr. Gordon, good morning.
Well, good morning to you, Ken.
Appreciate a chance to talk with you this morning. You're with Bronson General Surgery Specialists. What types of surgeries do general surgeons perform?
Well, general surgery does a lot of different things, to be honest with you. We have a basic training, and then a lot of people will go off and specialize a little bit into things such as oncology, even specialize and do breast care, go in and do endocrine surgery. That'd be something like thyroids and parathyroids, and then also trauma care, intensive care unit issues with that. Personally, I do more, the majority of things that I do are things involved in the abdomen, such as gallbladder surgery, the most common issue I do, as well as any kind of hernias, a lot of different types of hernia surgery. And then we also cover what I would call acute care surgery. So that's something that you come into the hospital for typically on a more urgent basis. So most common things people think about: appendicitis, an acute infection in the gallbladder, bowel obstructions, things like that. So we take care of a lot of different things.
Dr. Gordon, we're here talking this morning to let everyone know that Bronson is once again scheduling surgeries. Has Bronson been performing these types of surgeries all along?
Well, we have been, but part of the issue, of course, is that as this thing came across, there was a lot of unknowns about it, and we were expecting a little bit of a surge, as what happened on the east side of the state in the Detroit area. Fortunately, we did not get that surge that was there. However, we kind of had to prepare for that, and the hospital did a great job of setting up a command center, and we kind of ranked surgeries or conditions in a tiered type system from 1 to 5. So, for example, you can make a whole nother discussion about ranking the different types of surgeries, but 1 being, you need surgery now, it's a life-threatening type situation, then all the way down to 5, which is purely an elective situation, and those can be put off. And you can actually even the same patient can vary within that system depending upon what's going on. And so the people that needed surgery got the surgery, but we did have to push some people off a little bit that didn't require that. And again, the reasoning for that was that we had to prepare ourselves for a possible surge that, again, fortunately, we did not get. So we've also learned a lot more about this virus as things have moved along. We've learned about what's happening in the community with additional testings. And so at this point now, we realize we want to get people back and perform all these procedures that we had put off for a little bit of time.
Dr. Andrew Gordon is with us on WKZO, the Bronson Health Chat this morning. What do you say to patients who feel it's too soon? They're worried about their safety.
Well, a couple of issues. One is Bronson has always been putting, I'd say, patient care and patient safety first. But again, we've ramped these things up to another level. So the command centers, which involve all aspects of the hospital system, not just physicians, obviously. There's so many aspects of the hospital system. They put together nice protocols, hand washing that's been standard, and hand sanitizer, and face mask, and distancing, and how we handle the surgeries, even coming in, different protocols within the surgical suite itself. And all these things are ongoing, and we have not seen any issues at all as far as the safety of the patient goes. And so you don't want to be putting surgeries off at this time, because then that can have its other effects as well.
And that brings us to the question of those who want to put off their care until the pandemic is over. Why shouldn't they make that a consideration?
Well, one thing is that the acute situation, I suppose, the surge we don't see at this point, but COVID is going to be around for a while. It's not just going to completely disappear here, and we've learned to deal with this issue, and we've got to learn to live with it to some degree. And the other issue is if you start putting certain aspects of your care off, then other things can happen. It can be very significant. You think simple things as screening procedures. You want to catch cancer issues early. I think of my own issues as far as gallbladder type issues go. It's so much easier to treat somebody what I call an elective basis, as opposed to waiting until they develop a bad infection or other issues, and then that situation is harder to treat, and other issues, complications and things can go up because of that. So you really want to, as with almost any disease process, you want to catch it as early as you can, and it's just much easier to treat. So if you start putting things off too much, it can have more deleterious effects on you down the road.
Well, doctor, if patients have questions about this, where can they turn?
Well, I'd suggest just talking to your docs and calling the places where you've had the procedures. Now, some of these things we put people off. Now, our offices should be contacting those patients and getting them rescheduled. But if you haven't heard from them, call that office back and say, hey, what's going on here? And they'd be more than happy to get you involved here. And the other resource I always say is going online, looking at something like the American College of Surgeons has an excellent website. They've got a lot of information there, and these are things that you can get some information at and ask your physician about directly.
Dr. Andrew Gordon has been with us on our Bronson Health Chat segment for this week. Dr. Gordon is a board-certified surgeon with Bronson General Surgery Specialists and is a member of the American College of Surgeons. And Doctor, thanks so much for joining us this morning and sharing this important information with everyone.
Thanks a lot, Ken.